Lisa Farley, and I'll be doing my presentation on my formal paper, The Effects of Healthcare Disparities Among African American Women in Mammograms. And I hope you enjoy the presentation. The effects of healthcare disparities, noncompliance with mammograms among African American women. I'll be discussing the risk factors. I'll be discussing the educational disparities as well as cultural. Most African American women do not get the necessary screenings that they need in order to be compliant with their health care. They're not familiar with their health care. In many cases, these women do not comply because of cultural and socioeconomic factors. Mammogram screenings is very important for all women when they reach 40 years of age or have a strong family history of breast cancer. In the African American population, most breast cancer is discovered in advanced stage, and it's a little bit too late when they do find out. According to Kidd, Colbert, and Jatoy, ongoing debate about mammography screening for women in their 40s has brought awareness about the opportunities and challenges for achieving optimal breast health in young African American women and in battling health inequities that place them at greater risk for mortality from breast cancer. If more knowledge of risk factors was disseminated, there could be clearly better outcomes and compliance in the low socioeconomic areas. Knowledge about the disparities and consequently having lower rates of compliance often present in later stages of cancer development. The purpose of the paper is going to investigate the reasons for noncompliance with mammograms in the African American women population. Cultural factors and social support. Religion has always played an integral part in the African American population. Religious beliefs are very strong, and faith in God is a stronghold for many who believe in God that will heal them. Even though faith is a major source of healing, medical intervention is still necessary for certain conditions, and the doctor-patient relationship is very critical. Patient autonomy and inclusion in treatment options and care puts the patient at the center of the care, and spirituality is important for African American women that's coping with breast cancer. Research indicates that social support also affects African American women seeking medical care and adherence to treatment. Lack of knowledge and knowing the benefits and the risk of getting the necessary screening tests done with more resources, more clinics, more mobile units that can come out and educate in low socioeconomic areas where transportation is a problem, where childcare is a problem. If they had the actual knowledge, it would benefit the African American woman to be more in tune with herself. Education, as far as education in the low socioeconomic areas, they lack the education necessary to seek answers or ask questions from physicians opposed to the Caucasian female. A delay in treatment can also be a problem based on transportation. Once again, child care, not having the financial means to get there, treatment is also delayed. And also, a delay in treatment can be caused by what African American women feel is a mistrust in the medical field. They feel like they're not heard, or they don't. Their other physicians really don't know who they are, and they don't understand what they really asking and what they need. Financial is insurance. It plays a key role in preventive screening and follow-up care. The sooner a diagnosis is made and treatment regimens in place, the better the prognosis. But if you don't have the financial means, then there's kind of a hard way to actually get the treatment that you need. Risk factors. Researchers found that genetics and family history are significant when it comes to patient knowledge in regard to genetic predispositions. And once again, by knowing your genetic makeup, knowing your risk factors, it helps the physician know how to treat and what they can treat you for and actually look for to prevent anything from occurring. Knowledge of these factors allows the provider to initiate proper testing and genetic counseling for early detection and treatment that may be found at a later stage otherwise. Studies also in diverse populations are needed, where it appears to be a need for more education for African American communities and for physicians serving them regarding the role and value of genomic and genetic counseling. Incidence and prevalence. Research indicated African American women compared to Hispanic, non-white, Asian, and American Indian populations were more likely to be diagnosed at more advanced stages and less likely to receive recommended treatment. African American women have aggressive breast cancers at younger age. The survival rate of 78% versus a 98% survival rate of white women. A 5-year survival rate after being diagnosed. The highest death rates from breast cancer as they tend to be diagnosed later. Become more informed and empowered in their health and in their lives will decrease incidence and prevalence as far as better outcomes. In conclusion, disparities in the healthcare system require more patient outreach, effective communication techniques, and inclusive patient-centered care. Thank you.